Good afternoon, everybody. This is Val. Today we're going to be talking about global health, communicable diseases, and infectious diseases, and how they impact community health of our populations. Our learning objectives today are to review infectious disease transmission processes, the different types of infectious and communicable disease. We should learn how to differentiate primary, secondary, and tertiary prevention. We'll demonstrate principles of infectious and communicable disease control, and hopefully evaluate effectiveness of infection control practices on rates of infection and communicable disease spread. So as we start, let's just take a quick look here at the epidemiological triangle of disease. As you can see, at the center of this triangle is the disease itself. So for example, you might have tick-borne illness such as Lyme disease here. And interconnected with the disease are these three components: the environment, a host, and an agent. The environment involves things like the climate, housing, healthcare settings, travel, the different physical as well as geographic environments involved in disease transmission. You may also have a host. For example, vector-borne illness such as Lyme disease is born out of mosquitoes, out of ticks. So that would be a host. I'm sorry, I got confused there. When we think about the host, that would actually be us as a person. The agent is things like viruses, bacteria, fungi, and parasites. So for example, ticks are the agent for transmission of Lyme disease to the host, the person. So going through that one more time, the disease in the center of the circle, all influenced by the environment, the host, and the agent. Here's a graphic description of how Eastern equine encephalitis is transmitted. If you look at the left side of the picture, you'll notice that the primary transmission cycle is between birds to a mosquito to birds, back to mosquito and birds. So it's a cycle of transmission. The mosquito itself can come out of this cycle and go right to humans, and that is what can cause illness, and then mosquitoes biting or infecting horses. So you have this disease that has these cycles. And again, the vector, insect-borne vector is a mosquito, and you have birds as primary, and also humans and horses. Infectious disease is probably one of the most significant public health issues of our time. When you think of MRSA, for example, or some of the other antibiotic-resistant viruses that are, bacteria that are invading our healthcare systems, it doesn't take us long to realize how important management of these diseases is. If you look here, I've included a slide here on the World Health Organization pandemic versus epidemic outbreaks. And they have 5 strategic categories that they use when they're analyzing how an outbreak is occurring. So for example, communicable diseases, things like measles, mumps, rubella, chickenpox. 2 non-communicable diseases, diseases that are spread, but they're not traditionally spread through traditional modes of disease spreading. Health through the life course is the 3rd category of infectious disease. And number 4, health systems, how we can impact pandemics and epidemics is based on health systems. And then how we prepare, survey and respond to outbreaks is a critical piece of epidemic and pandemic review. So in the United States, we have a structure as discussed in our first lecture of where we have the Centers for Disease Control. And in 2016, the centers identified that a list of diseases and illnesses that should be reported or must be reported to the federal government. You'll notice that some of these diseases are pretty common. Things like botulism, again, that's a foodborne illness usually, something that we would want to be aware of for food safety purposes, but also cancer, carbon monoxide poisoning, diphtheria, and some of the more rare tropical diseases we don't necessarily have here in the United States, but may come from another global environment. So dengue fever, for example, or I'm thinking polio, pertussis, plague being one that certainly is not a common disease in the United States, but something that should be reviewed. So this current list is updated periodically, and you'll notice that you have the opportunity to identify whether you just want a list of infectious diseases, non-infectious, or outbreaks. Primarily, reportable conditions are usually reported out of a primary care office, but hospitals are also a source of reporting to the CDC. Again, this helps with surveillance and tracking of illnesses across the country, and also helping to mitigate any significant problems in a local area, like the Zika virus, for example, which had an outbreak in Florida most recently. So a communicable disease is a disease that is spread from one person through another in a variety of ways. For example, contact with blood and body fluids, breathing in an airborne virus, or being bitten by a mosquito or an insect. HIV, AIDS, sexually transmitted diseases, hepatitis, tuberculosis, polio, diphtheria, all of those are considered communicable diseases. So the first disease we want to just talk about briefly here is HIV/AIDS. I think it's very important to recognize that this is a global health problem, not just in the United States, but also in many parts of the world. And for example, in Africa, it has reached epidemic proportion. So we're going to look at how the virus is transmitted. And I highly recommend this website. It's called AIDS.gov, and it gives you a nice central location where you can find everything you need to know about what's happening currently. It gives you statistics, symptoms, and what you can do if you're a professional working with somebody with HIV or AIDS. So the first thing is that HIV is a virus that attacks cells of your immune system. So once you receive that virus, HIV, it attacks specifically CD4 cells or T cells, which help our body fight infection. If it's untreated, it reduces the number of CD4 cells, and your T cell count is dramatically effective. And one of the challenges of HIV is that it makes you more susceptible to some specific types of infections or infection-related cancers. The best way and only way that we have available to us of whether somebody is HIV infected is to have a simple blood test. The next area is we want to really be cognizant as professionals of the current facts about the statistics and epidemiology of the infection. So you can see by these pictorial graphics that 1 in 8 people are living with HIV do not know that they have the infection. One of the main reasons, for example, that we have standard precautions is because of this particular statistics. Treating every patient that we see as somebody who may have either hepatitis or HIV infection undiagnosed. The next pictorial, you can see that there are 1.2 million people in the United States living with the HIV infection. That's an incredibly significant statistic in that we have had some significant success in keeping people healthier for much longer with that infection. And the last pictorial graphic identifies that gay and bisexual men of all races, regardless of their race, are the most severely affected with HIV. So again, we have a vulnerable population that we're working with, and we want to make sure that we're continuing to be advocates as nurses to ensure their safety and their continued health. The same with people that have who inject drugs. Heterosexuals also continue to have and spread HIV infection, and then African Americans, they continue to have the greatest burden of HIV. So again, we have some health disparity here. We have significant statistical information available. Definitely a public health issue of concern within the United States. Now, as part of the public health network, our primary goal, again, is to reduce infection and sexual contact or sexual risk for HIV. So as nurses, we need to be very familiar with the categories for lowering risk. For example, choosing less risky sexual behaviors, using condoms correctly and consistently, reducing the number of sexual partners, getting tested and treated, using HIV medication to reduce their risk, and encouraging partners to get and stay on HIV treatment. Significant public health issue and something that we as nurses often come across in our daily practice. But as you can see from this website, there's a lot of good information, easy to understand, easy to read, and well-developed public health messages. So sexually transmitted disease is another area of communicable disease that we often are confronted with as nurses. Statistics can be quite alarming in some populations. Again, the Centers for Disease Control can be very helpful in providing us with information on the spread and the epidemiology of sexually transmitted diseases, both at the state and federal level. Something to keep in our forefront of our mind as we move forward into practice. The second is outreach education. There's a national outreach called Let's Talk, or Be Smart, Be Well. As you can see, how the message gets across, these are some historic pieces of public health information. This middle one, for example, came out of the 1950s. I believe 40s and 50s, when there was a lot of military men receiving and getting STDs during deployments. Very different message than what we have today, which is this message was use a condom, and this message of safe sex. And tailoring the message is one of the most critical pieces of helping to reduce spread. going to move on to hopefully to our next slide here. There we go. Okay, so sexually transmitted diseases, again, the Centers for Disease Control, very active in helping to get messages out to specific populations. You'll notice they have 3 populations. They're targeting gay, bisexual, and other men who have sex with men, and STDs during pregnancy, as well as adolescent and young adults target populations. If you take a minute and just review some of the information that is available on the website, you'll notice that many of the diseases that we see sexually transmitted can be prevented. Hepatitis is one of the biggest communicable diseases that for us as nurses, we're consistently aware of our potential for exposure. You'll notice that there are some very good resources available to help us better understand how to take care of ourselves and reduce our exposure or potential of exposure for hepatitis. Our second area that we need to be thinking about really is the, that did not open, is the OSHA rules and regulations regarding bloodborne pathogens. And as you start going into practice, you'll notice that your particular employer will offer you training for bloodborne pathogens. And it's very simple to get information about OSHA's requirements, which were actually not in existence not like an OSHA today, so we'll skip that part. There's a lot of information available online about through the Occupational Safety and Health Administration to give us information about bloodborne pathogens. As you will and probably have already experienced, every nurse is trained in standard precautions, and it is a requirement of OSHA that everyone who provides or has a potential risk for bloodborne exposures be trained on how to manage and use the personal protective equipment that's required. Tuberculosis, another area of significant concern to vulnerable populations. Again, the CDC taking the lead in giving us information and up-to-date current information about tuberculosis. If you end up working in a clinic or in an area of respiratory practice, you might want to sign up for their Twitter feed so that you get current information. You'll notice that they have a link specifically for different populations of very high-risk individuals. You'll notice that children, African Americans, correctional facilities, homelessness, international travelers, and then health disparities in tuberculosis spread. Again, those are important pieces of controlling the spread of tuberculosis and how it affects an entire population. Because of its method of transportation, it is highly regulated, and for those of you working in hospitals, infection control is significant. This is one area where, for example, because it's an airborne disease, we want to use a negative pressure room, a room that when you open the door, the air continues to stay in the room and not flows out into the hallway. The other piece to infection control, as the research is conducted, you'll notice that CDC is the lead for guidelines on how to manage the environment, but also what respiratory protective equipment we're required to use. With TB, for example, you're using an N95 respirator. If you're caring for a patient, this is beyond a respirator, a respirator that's just a basic mask. You do have to be fit tested for that respirator if you have a patient with TB. Has great guidelines here on what the environment has to be in order to prevent the spread of illness, and then any administrative measures that need to occur to help minimize the spread of TB. On the right-hand side of the slide, you'll notice that many organizations, including long-term care facilities and hospitals, use the NU412 tuberculin skin test as a screening test for exposure to tuberculosis. Most facilities are now using a two-step NU412 test. So the first step being administration of the tuberculin vaccine, tuberculin reagent, and the second step being reading the finding in a certain period of time after administration, usually 24, 48 hours. And then the third is interpretation of the result. One thing we need to remember if we're a nurse, this is a process that requires a little bit of training and education. It is an intradermal injection, so you're looking to have a wheal, W-H-E-A-L, when you administer the reagent, and then you will read the induration, which is actually not just redness of the site, but there's actually a little hard bump that occurs if the person tests positive. All readings are recorded in millimeters. So if you have a reading that you can't find any induration, that's usually reported or should be reported as 0 millimeters. With a little practice and a little training, this particular test is fairly simple, and it's a great way to screen. Now, somebody who has had a historic exposure to tuberculosis may test with a positive result of greater than 0 millimeters. And usually what happens in that situation is the primary care physician will order a chest x-ray just for confirmation, whether it's latent tuberculosis or an active case of tuberculosis. An important finding: when in doubt, as a nurse, you're going to treat the person as having tuberculosis until you know differently. I'm going to stop here now, and then we're going to take a quick break, and then we'll come back and talk about infection control.